So when I see a patient for the first time who's presenting with low back pain, I usually just run through a series of questions. I want to get an idea of how long the condition's persisted. Is it an acute flare-up the first time it's happening, or has it been going on for several weeks to months to years? I want to know about their symptoms. Is there a difference throughout the day? Do their symptoms get worse in the evening, worse in the morning? I'd like to know what position they're sleeping in most of the time, if they're able to sleep, how frequently they're waking up at night. And I'm looking for consistent patterns. So what I want to know is, for example, for spinal stenosis, a classic presentation is a person will tell me, well, I can push a grocery cart as long as I want, but I can't really walk for more than 5 minutes without increasing my pain. Another common condition or development I hear about is a patient will present and say, well, I'm stiffest first thing in the morning. I can barely move my spine. But then mid-morning, I feel my best, the least amount of pain and the most mobility. But then by late afternoon, early evening, it's a different kind of pain that sets in, one in which I feel more of a nerve type sensation. And so part of what we do is we explain that, well, it's because your spine changes throughout the day. Your discs are more swollen in the morning because you're not standing against gravity. It's normal for a patient to be a 1/4 inch taller in the morning than they are in the evening. And so in the beginning, that stiffness early in the morning is due to a swollen disc, but that swollen disc gives you space for the nerves. And so as the day progresses, you hit that sweet spot mid-morning, early afternoon, where the discs have compressed, but not to the point where anything starts irritating the nerve. And then by evening into the night, the discs have continued to squish down. You've lost fluid within those discs. It's a normal process, but the idea is now we start to irritate that nerve at the nerve root. And so the symptoms now become more nerve-based as opposed to early in the morning when it was more stiff and sore. So these are the kind of questions that we're going to ask at the initial evaluation, and then the treatment usually over the first couple sessions is a combination of some light range of motion activities just to loosen up and warm up the tissue, and then some hands-on strategies like massage, manual stretches, nothing that should increase pain or symptoms. And what we're doing is we're continuing the assessment throughout those first couple of treatments. We'll give you things that you can start doing at home to manage your symptoms, because a huge part of what we focus on is how you can handle the symptoms yourself, because you'll probably have a flare-up into the future, but the quicker you address that flare-up, the shorter it persists, and the less likely you will need further medical intervention.